Well, as we reported last night, Governor Steve Sisolak declared a state of emergency here in Nevada, and he expressed frustration with the federal government and really a lack of communication.
So even the governor said he didn't know when the CDC would be sending those additional test kits to Southern Nevada. And the I-Team's Vanessa Murphy has broken several stories on this. She's here now with how the health district is responding today. Vanessa?
Yeah, and as you mentioned, the governor of our state said he doesn't know when the CDC would send more tests. The Southern Nevada Health District doesn't have an answer either. They tell us they're waiting for answers from the federal government. The director of community health said we have 1,000 tests available right now. He'd feel more comfortable if the 20,000 kits that have been requested arrive. We also learned the lab is at capacity, and some hospitals and doctors are reporting a shortage of viral transport media. For example, tubes used to protect and transport the tests. We are hearing from viewers like Nora Mirabal, who tell us they feel sick. They want to get a coronavirus test and they're being denied. She says she visited California last weekend, came back, developed a fever and breathing trouble, but cannot get answers about how to get a test. In the meantime, she says she is remaining isolated at home. We asked the director of community health about the struggle viewers are describing in trying to get tested.
Oh my goodness, I am angry. I am so frustrated. I mean, extremely frustrated. How can we not have medical assistance for an illness of this magnitude when we knew about it in December at the very least? Why have we not prepared for this? And how can I not in America have medical assistance? And
they're saying they're getting bounced around. They're calling the health district says call your doctor. They call the doctor says we can't help you. They call a hospital. So what is the right thing to do if you do feel like you are sick with this?
I mean, the right thing to do is to call your health care provider if you have one. If not, they can call the health district and we will provide guidance for what the next steps are for.
But they're saying they're not getting guidance, that they're reaching dead ends.
Well, I mean, we are receiving, as you might imagine, multiple calls a day, and we're doing the best we can to try to respond to everybody's calls and emails that we're receiving. So I would just suggest that they keep trying. That's our protocol right now.
If you want a test, you'll be asked if you traveled and where, if you had close contact with a positive case, and if you have a fever and breathing trouble. You would likely first be tested for the flu and a respiratory illness before getting a coronavirus test. Now, LabCorp and Quest Diagnostics announced earlier this week they are offering testing through healthcare providers. Leaders at the health district say they are aware of that happening locally and that must be reported to the health district, but they don't know how many tests have been done yet through those private labs.